You're listening to the Podcast Detroit Network. Visit www.podcastdetroit.com for more information.
Welcome to Smart Sex, Smart Love, where talking about sex goes beyond the taboos and talking about love goes beyond the honeymoon. I'm Dr. Joe Court. Thanks for tuning in. Hello, and welcome to all my new listeners and all of my existing listeners. Today we're going to be talking about a special topic, the coronavirus. The novel coronavirus, also known as COVID-19, has given all of us cause for concern. In light of the pandemic unfolding all over our world, this week I'm doing a special show dedicated to mental health and coping during COVID. The outbreak of COVID-19 can be stressful for many people. Fear and anxiety about a disease can be overwhelming and cause strong emotions in adults and children. My guest today is Kim Stevens, MSN, RN, CNOR. Kim, who has been a registered nurse for 25 years, is currently Director of Clinical Operations for a third-gen health group in Troy, Michigan. She is also getting certification on coaching patients on stress management and resiliency through Massachusetts General Hospital and Harvard University. Kim is here to talk about non-panic ways to respond to COVID-19 and how to manage coronavirus anxiety. The facts, not fiction. Welcome, Kim.
Hi.
So glad to have you here to talk about the facts and not the fiction and how to help people deal with their anxiety and not to panic. Thank you for being here.
You're welcome. Thank you so much for having me.
So what would you like us to know maybe from the start about this coronavirus?
Well, first, I want to say to all the listeners that you're not alone. There are a myriad of resources out there to manage your stress and anxiety, but I always like to go with one source of truth. And that one source of truth is the CDC, the Center for Disease Control and Prevention. They have on their website, cdc.gov, a number of resources as far as the numbers, as far as the symptoms, and also a special site within their site called Manage Anxiety and Stress. And here, this is where not only can we hear together, you and I, of what to do, but later people can go to the cdc.gov, the Managing Stress and Anxiety site, and look for themselves to really remind themselves how to deal with the stress, how to cope. Because if someone gets too stressed and cannot cope, then this does affect their physical health. And at this time, we want everyone to remain as healthy as possible so that we can get through this together. So I can take you down on this website. First, it talks about stress and coping, and everyone responds a little bit different. Older people with chronic diseases, they are at higher risk. So of course, those 60 and over, they're going to be a bit more heightened because, of course, this affects you with things that are beyond our control, the beautiful thing called aging. And then children and teens, because their parents, their caregivers may be a bit stressed about it, these children and teens, they're looking for that solid leader to say, I got you. And if that leader within their household is stressed, then that's when children and teens become so much more stressed, but we may not see that because they're great chameleons. They can hide it. So on down, especially people with mental health conditions, those people, we're already stressed. We're already a stressed environment with mental health issues. Now put this on top of it, and the whole world is swirling. So to get out to all these groups to say, we got you. And here's some information as a reminder. So during this infectious disease outbreak, you may have changes in your sleep or eating patterns. You may have difficulty sleeping, concentrating, worsening chronic health conditions just because the stress response, like I said, that we have, it comes out in our physical response. And some may, see an increase of alcohol, tobacco, or other drugs, using that as a way to cope. So I always like to remind everyone, all of our patients and everyone, if you're feeling overwhelmed and you can't get on the line and talk to myself or talk to one of our physicians or providers, please go to the Substance Abuse and Mental Health Services Administration. There's a helpline. It's 1-800-985-5990, or you can text Talk With Us at 66746.
Let me tell you, if I could just interrupt, I really like what you're saying, but I just want to add some things. One thing I think that we have to be careful about, I don't really like this term social distancing. I've been calling it physical distancing, that we need to maintain being social. And we can do that through the internet, through webcam, through telephone. And I feel like that people that are having any kind of mental health issues should not do exactly what you asked, but also let's stay in touch. What I've been doing is webcamming with my friends, group webcamming. You can do that with FaceTime. You can do it with Zoom. You can do it with lots of platforms on the internet. And it's calming us down to say, hey, we're still here with each other. We're social beings. Staying physically separate might be necessary, but socially, I think it's important to continue.
You are 100% correct on that. And I love and thank you so much for talking about this, because absolutely, social distancing is 6 feet. But here at Third Gen Health, at all of our family practice sites, we are doing video conferencing, not only with those that are ill, that need to have our time and attention, but also doing proactive reach out to those that we may not know. They may not have called us, but we are calling them. So to speak to just a reach out, whether it's your physician provider, whether it's friends, it's a great time, you are right, to reach out, FaceTime, phone, video, whatever it is, because in this time of pandemic, we need each other more than ever.
And can I ask you some specific questions? Because I have clients asking me things and I have my own questions. I mean, like, for instance, I just heard that people that are older are more susceptible, and you just talked about that, but that people that are younger, if they are asymptomatic but a carrier, they have it 7 times more than the person, an older person. Is that true or is that not true?
I as far as, hard numbers, as far as, who's more virulent than the next, I hate to, speak to that, because right now we're in the gathering data phase. We don't know all there is to know about this coronavirus. Of course, in a time like this with ambiguity, people want black and white. They want an answer. But there's not many answers right now. So we're gathering that data, and the CDC is gathering that data, and the World Health Organization is gathering that data. So then we will have, confirmed whether someone's 7 times, whether it's this age, that age. We'll have more information. But right now, as far as, active outbreak, we're gathering the data, and more to come.
Yeah, it's a really good response, because I remember, so I'm 57 years old, and in the 80s, when HIV and AIDS came out, I mean, this was very, very similar. We didn't know what brought it on. We didn't know how you could catch it. I remember, I don't even remember what year, I keep meaning to look it up. Barbara Walters from 2020 was holding a baby that had AIDS, and she was kissing it and touching it and rocking it, and she was saying, it's okay. Like, we finally knew better at that point, but people were panicked. And I remember, of course, as a gay man, being stereotyped and out, like, before they had enough information, that we were already stigmatized. So I appreciate your answer.
Yeah, you're welcome. And that's why I stress going to one source of truth. Gather your information from the cdc.gov. They update their site regularly every day, and go there, because you could get it from the media, you can get it from your friends. It's a runaway train. But go to one source of truth. Go to the cdc.gov and find the real information. Yeah,
meaning you can get information, runaway train information is what you're talking about.
Exactly.
Right.
Exactly, like a friend of a friend. And then that increases your stress and anxiety.
So when people say, do you know what happens? So let's say you are tested and you actually have the virus. How long does it last? How long does it go away? Do you know that information?
So as far as, how long does it last? You are infectious, they say 2 to 14 days. That's why they have the quarantine for, 14 days. As far as how long it lasts, again, we are still learning all there is about this COVID virus. So I'd hate to, give a hard, fast number on how long it lasts and then another site or it comes out differently.
Yeah.
So I do know we have our arms wrapped around, how long we're infectious, but how long it lasts, that could be, someone could take that all different ways. So I'd hate to speak to that hard, fast number.
Since you're in the medical field, do you have a sense of why were people not taking this very seriously at first? I'm sure it happens with other things as well medically.
So when you say not taking it seriously, are you saying in January we heard about it from China, but
Yes.
It wasn't really here?
Yes.
Is that what? Okay. Because we always hear in the news about other countries and things happening in other countries, and our country is sometimes or most of the time not affected. So when people, see it in the news about other countries, they're like, oh, that's that country, that's not mine. So now when it's getting closer to home, people are like, oh, shoot, it really is real. So we've been talking about this since January, but since it hadn't come to the States until a bit later, I don't think, right or wrong, I don't think that, people took it seriously because they did not think possibly it could affect us.
Right. And I remember, so a lot of my psychotherapy conferences, I should be at one now, and then there's one in a couple of weeks, and there was another one out of the country, and a lot of people were saying we're still going forward because they didn't really get it. They didn't understand. And then suddenly it was like, we get it. It just seemed like it came on really, people started locking down really fast.
Correct. Because, again, we'll speak about the runaway train. Once it is in your area, just like the flu virus or any virus, it can be spread very quickly. So that's why, people are like, oh my goodness, it really is real. Wait a second. Yesterday was this number. Today is this number. Today we have in all 50 states. Oh my gosh.
Right.
Oh no. But I think the greatest thing that I always remind patients and colleagues is, and for anything, let's look at reality. What is the reality? Quit thinking of 3 or 4 things that are what if or could be. Let's look at the reality. Because once we start getting our mind into that, what ifs or this and that, then we start heightening and getting super stressed, and then we forget what reality is. We all do it. I myself do it with something. We look at a situation, and then we think of 3 or 4 things, and then we forgot what the reality was. So if we just pull ourselves back to reality, then we can stay grounded and then move forward with a good plan.
And that can be so hard for people. It's easy to get into a group panic. You're at the grocery store, you're at a mall, wherever you got to do whatever you need to do to get your stuff and go back home. And if you see a lot of anxiety, it's easy to blend in with that. And so as therapists, we always say, come back to yourself. What do you need in this moment to separate yourself from what's going on in the group? For me, what's helped me is I could get panicked, I guess, if I thought, oh my God, this could be widespread and mass deaths. But when I think about what really this physical distancing is about is prevention, stopping overflow of hospitals and medical care so that we aren't at risk of all getting sick and not having enough care. That helps me. I'm more of a prevention guy than I am a guy that's in the middle of a crisis. Now, what do we do? So I take a breath when I think of prevention.
Yeah, you're 100% correct. And I always say in times like this, if you can't be close, you can still have, nonverbal. So, for example, I was at the grocery store yesterday. And, people were looking away and looking down. And I looked at people. Of course, I was the appropriate distance, but I put my hand up and waved, and I smiled as big as I could just to say hi. And just from that, so many faces, a couple people looked away, but I think it was afterwards like, oh, shoot, hi. But so many people raised their hand and smiled so big, like, thank you. Thank you for just waving and smiling and saying hi. And, let's not forget that. We don't have to be, talking close, but we can just nonverbal, smile, wave hi. That's all it takes.
Yes.
A smile goes, it's 1,000 words.
So what do you say? I don't know if you can speak to this idea of, like people having hookups, right? So you're in a monogamous relationship. You're fairly safe there. Hopefully there's no breaking of the relationship agreement and cheating going on there. But what about single people who are, or just open relationships where they're hooking up? What are the safety cautions that they should have?
Well, as with anyone hooking up, whether you're monogamous or not, because let's face it, we're all out in the community touching door handles, touching different things. So number one, hand wash, hand wash, hand wash. I can't stress that enough. So hand wash. And as far as, keeping yourself healthy, first and foremost, good nutrition. Good nutrition can help that body to heal and help the immune system. So always think good nutrition. So whether you're monogamous or you're hooking up, everyone should have the same response, have the same protective response. And if you're if you're in a situation where you aren't in social distancing, make sure at this time that you're smart and that you're thinking of others. So if you're not monogamous, possibly it's a good time to be temporarily monogamous, just to think of others.
Okay, and I actually decided to talk to some gay men because of all the sexual orientations out there that have the highest hookups, it is gay men. Research shows that more than straight men and women and lesbians. And we've had to deal with this anyways when HIV came. So I asked some of my friends and colleagues, what do you say to the gay male community? And this is one of the things people said. He said, distancing is the only solution right now, but we are not going to die, but we can do our part avoiding the virus to spread and save elderly and weaker people. For sex is the same. Although we think we are healthy, many people are positive, but asymptomatic, spreading virus around. Wipe your genitals before and after does solve the problem. This is going to change our sexual habits for a long time. People all around the world are experiencing what monastic life means and what cloistered monks feel every day. Be safe and enjoy more. What do you say to that?
I say, spot on. Yes, temporarily we will have to, be monogamous. But then we have to remind ourselves of, why. It's of the greater good. It's for other people. And I believe, sex in and of itself, if you think of others, then actually it'll be more pleasurable for you. So it might be for those that are not monogamous, it might be a new way of life form. They might find that they love it, and then they start practicing that.
Yeah, I like what you're saying. I would just add, as a sexual health therapist and as a sex therapist, that we always that is what people do when they get afraid. They go right to monogamy, like that's the only way, and it might be the safest way. I mean, probably the safest way would be masturbation, right? Just sex with yourself. I always jokingly say it, but it's true. You cannot get an STI just from masturbation from yourself. But it's most likely not realistic for many, many people to just do monogamy. And so I really think people need, in greater than ever, sexual health conversations with each other. We're about to hook up. What does that mean? Do you know your status? Most people aren't going to know the coronavirus status. How are we going to make sure that we do this in a responsible way with each other? It's going to force people to talk, which I think is a good thing.
Communication, I'll tell you, for everything and anything, whether it's personal, professional, I don't care what it is, communication is key. So it will open the lines of communication, and with that, people can build deeper relationships and actually start respecting one another, a bit more. Because, whether, monogamous or not, that is someone's choice. But at the same time, we have to look at safety. Safety is always first. And if we can't have all of our boxes checked that this will be safe, then at this time possibly shouldn't do it. And then think a bit deeper, why you are wanting to engage in this unsafe behavior right now. Not that monogamy or is safe or having multiple partners is unsafe, but what I'm saying is, in this time of COVID virus, if not all the boxes are checked for safety, don't do it.
Yeah, and I don't disagree with your point. I just know that people are still going to do it. I know that when the AIDS crisis came around and they shut down all the places people could go to have sex, they found other places. And I think about teenagers. I just think I'm hoping that this forces our country to have medical conversations, but sexual health conversations. So people are, because we don't have them with teens, and teens are going to be hooking up. A lot of them aren't going to think of this as, a time for abstinence and a time for monogamy, and they're going to do whatever they want. And I'm hoping parents will step up and talk to their children about what that means, because we could turn a blind eye and say, be this way, and do as I say, and people are going to do whatever they want,
Well, bottom line is, if somehow, a virus is a virus, and if someone should get the COVID-19, what we do is we treat the symptoms. There's no antibiotic to help this. There is no medication such as we give Tamiflu for the flu. Viruses treat the symptoms. So if you should, get the symptoms of fever, cough, and know you've been around someone that has been diagnosed or suspected diagnosis of COVID, then be smart and start treating the symptoms. Go see your doctor, or go to one of the sites where they have the drive-through testing. Many of the hospitals have it. I know Beaumont has it, Beaumont and Troy, and a lot of the other hospitals have it. So Henry Ford has it as well. So be smart. Listen to your body.
Let me ask you something. I had somebody that went to Beaumont, and they had all these symptoms, and they were told they weren't going to test them because they didn't meet all the criteria. So what would that be? Like, what would be something? Why would someone get turned away and not meet the criteria? Do you know?
So first, I would have to ask. So when was this time frame? Because from the time that we had our questions in January to the time now is a little bit different. So it depends on at what timing, because the information has changed greatly day by day, week by week.
Yeah, this past Sunday.
So this past Sunday, so there are questions. There are the symptoms. So first, they ask if the person has the symptoms, fever, cough, like that upper respiratory, type cough. Then they ask them, where have you traveled? So of course it's everywhere now, but we still, want to identify within those last 14 days. And, of course, this isn't so much from Sunday because really people haven't traveled, but there's those high-risk countries. But also there's a question, have you been around someone suspected or diagnosed with COVID? And those were the three questions. Now, today, because actually as of yesterday, some of the guidelines changed, and now they are swabbing more people because it is here in our area, and they are first testing for the flu. So if you are test positive for the flu, then your symptoms are influenza A or B related, okay, or RSV. So they do those 3 tests.
Mm.
And then if they're negative, then they will send it on for COVID testing. So I know that even as of, Sunday, Monday, some of the, questions, were still a bit strict. But now that it's here, now that we have actual diagnosed cases in the area, in the local area, that question of, where you traveled or have you been around someone, may have, laxed a bit. So even from Sunday, that's how fast moving and changing this is.
Which is a good thing, right? Because then people can, be more up to date, and they don't have to be turned away. I also like the idea of practical things. Like I heard people saying they're going to the grocery store, they're wearing latex gloves. When I went to one store, the employees were wearing gloves. What do you think about like practical ways? Like for me, for a year now, I've been doing portion controlled meals where they're made at a place and they bring it to my house. And so for me, it's nice. I don't have to go to the grocery store. Someone is making it. I know the people making it. The only thing that we're shifting is they're not coming into my house or to the office. They're leaving it outside and we're exchanging it there. Do you have other practical ideas?
So I wanted to let me just jump to the, wearing gloves issue. So wearing gloves is just, I think it's, smoke and mirrors. With every contact, you should wash your hands. If you don't have if you're not readily available to soap and water, then use the hand sanitizer. Sometimes I think when people wear gloves and then they're touching door handles, how do you know that door handle wasn't already affected? And now you're touching food, now you're touching people's stuff.
Mm.
When you have an encounter such as, delivering food, such as an encounter, we just have an encounter, go wash your hands. It's a quick wash. So hand washing, it cannot replace glove usage. Sure, it can help protect, you and I, but that's for a small situation. That's not to wear around and, picking things up, and now you're just spreading it all over.
Well, I like what you're saying because there's this argument now out there, and some of it's harsh, but I like the spirit of it is it's not just about protecting you, it's about protecting each other. So the gloves would protect you, but what you're saying is it could still spread it to others.
Exactly.
I like that.
Exactly.
What about, I understand, and I don't know enough about this, but my husband was telling me that in China, things are a little bit better. Like they sort of have a better handle on it. Is that true? And if so, what does that mean?
So what that means is they're starting to get better. But the reason being, they're the ones that had it first. Because viruses, they can't stay in your body forever. They peak and then your body fights it and you get better. So they were the first to have it. So of course it makes sense that it's getting better for them because they've had it the longest.
And what yeah, go ahead.
No, it just makes sense. How any virus, the flu or whatever in your body, your immune system fights it, you get better, and then less people are affected, and that's why the numbers are going down.
Okay, and so people are saying here too, I don't know if you've heard this, that this isn't going to be a couple of weeks. This could be a couple of months. It could even be up to a full year that we're going to have to do this. What do you say to that?
So I say just like the flu season, we're gonna have people affected, and then it gets better, and then people affected again, and then it gets better. So just like the flu season, this is just one of those strains of viruses that's going to be around. Now, the second and third time that it comes around, our bodies have great memories, and we'll remember that virus strain, so that our symptoms may not be as drastic. So right now, this is a new virus that nobody even knew how to fight.
Mm-hmm.
So that's why this is so critical for elderly and those with heart disease and lung disease and, diabetes and, and different, different comorbidities. So, but as time goes on, it won't be so. So what I've heard is for here that we may see it, peak in, mid-May. And then as it gets warmer out and more people outside, just as the flu season tampers, goes down in the summer, so will this.
That's what I wanted to hear you say.
But it doesn't mean that it won't ramp up in the fall.
Right. Okay, but that's helpful. I wanted you to say that people need to hear that, because I think people are so panicked they don't know how much was this going to ramp up. Is there how long will I be in quarantine kind of thing?
Well, we'll be in quarantine until we see the numbers go down and as people's bodies start to, fight it off and get better. But we can't get better without decreasing our anxiety, having great nutrition, great hand washing, and protecting ourselves and others. And
it's so important. I think the government's been so good about, saying, like, we have these telehealth rules in mental health and medical health where we're only have to use certain platforms to talk to clients if they can't make it into the office. And they're waiving a lot of those things so that we can, because not everyone's up to speed. I do a lot of long distance discussions and consultations with people and clients. So I use VC, virtual site. It's made specifically for telehealth and medical health. And now there's Doxy, and there's Zoom is HIPAA compliant. But the government has said it's okay for a little bit, since we're in a state of emergency here, to use any platform you have. So clients have access to talk to their therapists, talk to their medical practitioners, and deal with their anxiety and depression or whatever's coming up with them.
I think that is so smart, and I think that is the right way to go, because we can't do it alone. We need each other. And for a therapist, a physician, a provider, a nurse, whoever, to reach out to that person, to just say, I got you. Yes. I got you, and we're going to do this together. We're going to get through this together. That's when people's anxiety will decrease, and that's when people will organically just start getting better.
I agree. What are any additional thoughts you have that you want to share before we come to a close?
I would say, again, kind of flip back full circle to the beginning. This is something where we need to fight it, but we need to fight it with each other and think of each other. So reach out to your loved ones. If you haven't talked to that brother, that sister, that aunt, that uncle, if you don't want to give them a physical call, give them a text. Just say, hey, I've been thinking of you. Because just that simple reach out will help people. And it will help to say, hey, I'm not alone in this. Everyone's kind of going through this. Okay, I got it. We're going to do this.
I love it. And I would just add the things that people can do to support themselves is, we've kind of already said it, but just as an overview, take breaks from watching, reading, or listening to the news stories, including social media. Hearing about the pandemic repeatedly can be upsetting. Take care of your body. Take deep breaths, stretch, meditate. Eat healthy, well-balanced meals. Exercising regularly, get outside, and it's becoming more spring and more easy to get out. Plenty of sleep, and like you said, avoiding alcohol and drugs. Making time to unwind, try to do some other activities people enjoy. For me, I'm always on the run. I'm writing, I'm seeing my clients, I'm traveling, and things get out of hand in my house. So like my rooms that I spend most of my time in are kind of a mess. So this is going to be my time to go into those rooms, calm down, and get my space in order and take a break, really. And to those people, if you're in a relationship and you want to do monogamy, great. But if you're in an open relationship or you're single and you still want to be sexual, just be very conscious of talking to others. And, people always make fun of people who are having cyber sex and webcam sex and, watching erotica, or what we also call sexual imagery or pornography, whatever you call it. For many people, that might be the way to go right now for a little while. Having sex with yourself keeps you at very low to no risk. And, just the continuing to connect with each other. This is a physical isolation, not a social isolation. Talk with people about who you trust about your concerns and about how you're feeling. Kim, I really appreciate you coming on the show. How can people get in contact with you if they want to talk to you more?
Well, I would say that the best bet, we can keep in touch. I would love to keep in touch. And if you're, hearing if people are, able to, call the show, then, we can connect to say, hey, this person is interested in talking, and I'd be happy to talk to them.
Great. So I could refer people to you if they contact me, kind of thing. Is that what you mean?
Yes.
All right, great. Thank you so much for coming in at this time, and it's a very timely conversation, and appreciate all your insight.
Thanks so much.
All right. Thank you. Thanks for listening to this episode of Smart Sex, Smart Love. I'm Dr. Joe Kort, and you can find me on joekort.com. That's JOEKORT.com. See you next time.